I am doing borderline intellectual functioning. The history on borderline intellectual functioning is different because according to the DSM-1, there's different cutoffs in the IQ scores. This used to be called intellectual disability, or it was intellectual mental retardation disability, but it's prior known as mental retardation because the brain levels are below average. The classifications were applied when the IQ of deficiency was listed as mental deficiency because their IQs were between 70 and 85, which is considered from a standardized IQ test alone, which is from a physician or a psychiatrist, which is recommended from a school or a therapist. The causes of borderline intellectual functioning is problems during pregnancy, like not enough oxygen, or brain damage, or exposure to toxins. It could be genetics from parenting have done drugs during pregnancy, or they could have given them a hereditary malnutrition. The child's not getting enough nutrients, like their protein or their dairy. The symptoms of this disorder is poor attention span. They can be in class and learn, but once they leave class, they forget all about what they did. They can have poor concentration. The concentration is learning stuff, but not understanding what they're learning. When they are giving questions, they respond in a slowly manner. They might not understand every question that's asked. They are very generally disorganized compared to someone that does not have this disorder. You could go into their backpack or into their room and find it completely paper everywhere and not knowing where anything's at. Their homework is generally not on time, or it's messy, and then not have anything properly placed in a properly place. They are overactive. Their voices are louder than other people's. They are hyper functioning. They have a very sense of anger. Their common sense levels from their actual age are poor and level. They have very low self-esteem. They will have naive. They're very controlling. Like I said, they will have mood swings really bad. Their diagnosis, they have to have 5 of these diagnoses, which, summarizing them, they have to have suicidal thoughts, thinking thoughts, wanting to kill themselves. They have to have recurring gestures. They have to lack their own identity. Like, they have to think they're not good enough, or they aren't this, they aren't that. They have to go to extreme lengths to real abandonment, like no one wants them. They have to be impulsive, like in sex or abuse, overeating, and speeding in a car. They will oftentimes think someone's talking about them and they're not. The treatment for this disorder is really simple. Family therapy. Now, someone with this disorder is not going to really want to use family therapy, but sometimes they will in their social skills training. Social skills training as in getting them with their peers or getting them one-on-one with their family and just going through some stuff to tell them they're loved. You also could do one-on-one training with a professional to talk about the problems if they don't want to talk with their parents. Sometimes they will do that because they're afraid of what their parents will think about them. Now, if that doesn't work and you've tried all the methods, that the psychiatrist or their family physician can offer them medication. The medication they really want to do a last resort, but some doctors will do that if the treatment is not working. But oftentimes the treatment does work. Medicines that they will often include could be Concerta, Adderall, Seroquel. They often will have anxiety pills. Sometimes they will give them stuff for their behaviors. Sometimes they will go through happiness when they're on this medicine. Sometimes they will not. So I'm going to show you a quick video of a person that has borderline intellectual functioning to conclude my video.
In the community. Hi, my name is Angelique Valadares, and I'm the parent of a child with an intellectual disability. Today's video will show you how children with physical disabilities and intellectual disabilities are able to function in today's diverse society. Living with disabilities can be lonely, scary, and difficult.